take-home messages. So grid computing is no doubt is playing a key role in the e-health, emerging area of the e-health, providing storage, computing power for initiatives in several biomedical disciplines. So these tools enables researchers to investigate diseases and rare conditions, as well as providing doctors with new ways to diagnose and treat patients. So as we all know, the arrival of 21st century that has become the innovative century for biological sciences, particularly in biochemistry and healthcare sciences. The advent of fast communication system and the advanced robotic system that has enabled making web portal system for dedicated healthcare system. So the huge knowledge that is coming from health monitoring system, that is from hospital information system, clinical information system, laboratory information system, management information system, for the patient safety, patient security, whether in hospital or home. The present state of the art is that knowledge should be focused with the patient rather than the whole environment of the hospital. So in this system, the availability of the web portal system that has made access for knowledge exchange between the physician, experts and the patient in secure way to achieve high reliability of the performance. So, however, at the end of the last and the arrival of the 21st century, that has warned the world to take care of biological attacks by natural or unnatural ways. So, first category of this biological dangers is viruses. So, these viruses are the continuous disasters to the immunity because it spreads fastly, causes mass destruction naturally. As in 1990, bird flu that was known as influenza at that time. So there is a large list of danger viruses. The majors are bird flu, swine flu, pig flu. So in 2009, and these strains are all found in influenza C viruses and subtype of influenza A viruses known as H1N1, H1N2 series, H3N1 and H3N2 and H2N3. So previous report indicates that 4,694 people that are affected with the strain of H1N1 flu worldwide. I was traveling from New Delhi to Hyderabad day before yesterday. I was reading in one of the newspaper, Lokmat Times, 30th August, the dreaded H1N1 virus has been detected in yet another Nagapurian. One of the 54 years old woman who's resident of Lalganj was detected positive for swine flu after test reports were obtained. The woman was admitted to the Chandak hospital. Blood and their samples of the woman had been sent to the Pune for test through the Mayo hospital. So in the second category of the biological danger, the expired dates drugs are sometimes distributed by the changing the packing labels and expiry dates, or wrong medications without consultation of the physicians and the experts of the e-health. So in the third category, contagious and non-contagious attacks like AIDS, hepatitis B and C, diseases attacks due to unawareness in the uneducated people of the society is spreading by the reuse of the needles frequently in the poor countries. So this is the hypothesis, the availability of the next generation networks like ultra-wideband and 3G mobile networks that had widening the use of multivariant system. So thus the use of parallel processing complexity in the field of knowledge management, e-health grid networks would provide huge public health monitoring in case of bioterrorism, biological dangers. So the aim is to design and simulate such a complex model in order to take preventive measures in the critical situation when biological attacks are both natural or unnatural. These are my research objectives: to design a system to convert serial into parallel multivariant system in order to solve the problems among the various patients, processing systems and experts in the relevant fields, to observe the wired and wireless systems used in collecting the vital science data for the patient management and expert opinion from the distant, and to take advantage for e-health grid web portal system for immediate measures to protect public health, and finally to develop simulative model to protect bioterrorism using 3G wireless networks. So E-health grid networks is feasible when multiple resources are shared in the form of distributed data. So in this system, we are remotely consulting the public health monitoring in the distributed manner. So moreover, in this system, it is mostly required that data could be managed in such a way to satisfy the public health care requirements. And these requirements should be secured to the public satisfaction in terms of reliability, their satisfaction, their security. So the concept of e-health grid can be thought as a public health monitoring knowledge management system as shown in the figure, consultant or pharmacists. So they are setting a node to form a e-health grid network where patient N is the number of PN is the number of patient N, ward carer number of patient ward carer, and consultant number CN stands for number of consultant and pharmacists. So they all are integrated with the e-health grid hospital management systems to form e-health grid network. So this is methodology. 3G mobile networks can be used offering medical supports at a distance for monitoring public health in case of biological dangers, whether they are nationally or globally. So the method is to take some parameters and simulate it by considering networks at various levels of integration. At first, it will be simulated at LAN, hospital level. Then it will be expanded to the metropolitan cities, like at country level. At large, it will be expanded to the global level, to the worldwide. The proposed models are based on e-health grid networks for public health monitoring in case of biological dangers and knowledge management through web portal system. So which proposed knowledge should be focused to the public health care and the localized environment for the reason of the security and the care. So for this reason, e-health grid web portal system would be designed. So here if you can see, if there are number of patients and they are being connected to the telemonitoring devices, knowledge of the patient that is collected or stored in the knowledge-based sharing and is shared with the experts wirelessly. So for this reason, e-health grid web portal would be designed for the purpose of static and dynamic knowledge of the patient and will be stored in the knowledge management system, static or dynamic knowledge of the patient information. Okay. This information will be managed through knowledge engineering using technology and engineering systems. So collective knowledge of e-health grids would be based on interactive system between the experts and the patients. So when large number of patients are involved, we make a knowledge management and public e-health grid to analyze multiple parameters of the patient using telemonitoring devices for distribution of patient information to the particular expert available for consultation from many concerned doctors in the particular area. So another scenario shows the bioterrorism can be monitored, controlled and managed remotely from the public in case of emergency through mobile and satellite communication. So this public health monitoring that can be controlled via using this e-health grid web portal system and via using these 3G mobile networks. This is one of the model for controlling and managing public health. So in order to avoid instant biological dangers, to make measures to manage and to stop or to control biological dangers, whether they are naturally or naturally. So it should be noted that biosensors, mobile and satellite networks play its role through software and hardware control system using 3G mobile networks worldwide. So take-home message is the biological sensor can be utilized to take preventive measures through the use of mobile and satellite communication networks to create worldwide biomanagement database information system. The simulation and modeling techniques will be exploited to do research in this particular area of e-health grid networks. So it needs high class of research, worldwide collaborations to meet the challenges of the biological dangers in any part of the world. However, biological sensors are still under research and that can be utilized to take preventive measures through the use of mobile and satellite communication to create worldwide management database informatics. Telemedicine system that will be helpful for that. So it needs high-class research worldwide. Thank you very much.
It's a pleasure to be chairing this session with Dr. Senthil Vel. We will take all the questions at the end, so we will move on to the next talk. I think for a doctor, the easiest way to feel old and outdated is to be surrounded by techies, because a lot of what you say sounds like a new world to us, and it's really nice because I work in an environment which is very technology intense, and we try to keep pace. So we'll move on to the next talk, which is very relevant to my area of interest as well. I would like to invite Dr. Revan Hanna-Cruz to speak on telemedicine and burn injuries. She's going to do a review of the literature and also a pre-study on unaided burn triage. Hanna-Cruz Revan is graduated from Copenhagen University Medical School in 2011, and she's currently in general practice. And she's also conducting research in the field of burns and telemedicine at a trauma center in Copenhagen. Welcome.
Thank you. And good morning, ladies and gentlemen. Thank you for the warm welcome I've had. So, my name is Hanna Rayband, or Cruz Rayband, and I'm from Denmark. And my presentation will hopefully be ready in a second.